Today we're looking at relaxation therapy,
Right.
specifically through the lens of Advantage Healthcare. They're a clinic down in Spartanburg, South Carolina.
Okay.
We've basically got their website as our main source here, and we're trying to figure out what they actually mean by relaxation therapy.
Yeah, what's their definition?
Exactly how they say it helps and, what they actually offer.
Makes sense.
You've brought the source to us, and it's probably a fair bet that you're maybe exploring ways to manage stress better, improve well-being.
A common goal for many people, yeah.
So let's just jump right in. According to this Advantage Healthcare site, what exactly is relaxation therapy? What are they claiming it does?
Okay, so right off the bat, the website defines it as a, quote, behavioral therapy used to relieve psychological stress and fatigue.
Behavioral therapy. Okay, that's interesting.
Yeah, the emphasis is right there. It's about identifying and maybe changing behaviors linked to stress and fatigue.
So it's less about digging into deep-seated emotions like some talk therapies might, more about actions.
Exactly. Less focus on, say, past experiences, more on the here and now actions and reactions. And they do mention it can be guided or, you can practice it on your own.
Okay, versatile then.
A little bit, yeah.
Yeah.
And they quickly link this whole idea to stress and the nervous system.
Ah, right, the physiological connection,
Yeah, the site suggests that stress might increase nervous system activity. Think fight or flight.
which can definitely wear you down or affect certain health conditions.
Precisely. Your autonomic nervous system, heart rate, blood pressure, all that can get really ramped up.
And the idea is relaxation therapy could potentially, what? Dial that back down,
That seems to be the suggestion. They say it might decrease that nervous system activity.
leading to maybe a slower heart rate, lower blood pressure.
Uh-huh. Less anxiety, maybe even improve mood for people with certain conditions.
Now, this is really important for you listening, and they're upfront about it on the site, which is good.
What's that?
They acknowledge that while they offer these therapies, the really strong scientific evidence for all these uses, it isn't always there yet.
That's a crucial point. It's valuable they state that. It shows transparency about the current research landscape versus clinical practice.
It does, but doesn't that put you, the potential patient, in a bit of a tricky spot if you're looking for something with rock-solid proof?
Well, it's a valid question. It really underscores why it's so important to talk openly with your healthcare provider. Ask about the evidence, understand why they're recommending something.
Absolutely. Good advice. So on the topic of uses, what do they list? Why might someone try this?
They list quite a few things. Obvious ones like stress and fatigue,
Okay.
also anxiety, depression, even physical complaints like chest pain, headaches, fibromyalgia.
Wow. Quite a range. But again, with that reminder about the evidence.
Right. That caveat hangs over the list. It means the research supporting each specific use might vary a lot.
So it might help someone, but it's not a guaranteed fix backed by tons of studies for everything listed.
Exactly. Approach it with, informed awareness.
Now, here's something I found really interesting. They go out of their way to say what relaxation therapy is not, in their view.
No. Like what?
They specifically list guided imagery, mantra meditation, mindfulness, tai chi, and yoga as things that are not necessarily relaxation therapies, according to their definition.
Huh. That is specific, especially mindfulness. I think many people would naturally group that with relaxation.
Me too. So why exclude them?
Well, by doing that, Advantage Healthcare is really drawing a tight circle around what they mean by it. It suggests their focus might be on a more maybe direct set of behavioral techniques, perhaps with a stronger physical component.
That fits with the behavioral definition, I suppose.
Yeah.
Less purely mental, maybe.
Could be. It sets their approach apart.
Okay, so whatever their specific definition is, they definitely position it centrally. They say it's an essential part of their holistic approach to healthcare there in Spartanburg.
Right. So it's not just an add-on. In their model, addressing your mental and emotional state through these relaxation methods is fundamental. It sits alongside maybe other treatments they offer, like chiropractic care.
And speaking of the physical side, they specifically mention massage therapy.
Ah, okay. That connects some dots.
Yeah, they say it's a key part of their relaxation services.
Yeah.
They talk about skilled therapists using various techniques
To do what exactly?
to target and release muscle tension, aiming to promote relaxation that way. And they emphasize that the sessions are personalized.
Okay, so that really leans into the physical aspect we were just talking about. Direct touch, muscle release.
Yeah, you can feel that direct effect, can't you? after a good massage.
Definitely. And the personalization is key too, because stress shows up differently in everyone's body.
Makes sense. Okay, so if you're listening and this sounds interesting, maybe something you want to explore, the website actually lays out how to engage with them. Pretty clear steps.
Oh, good. Always helpful when it's straightforward.
First, they suggest, the usual. Visit their contact page. Get the basic info.
Standard first step. See who they are, what they're about.
Then you actually reach out. Phone or email. They give the number 864-574-6840.
Okay.
Or email them to schedule. Ask about availability, maybe costs, that kind of thing.
Right. That direct contact lets you ask your specific questions.
Then, when you go in, there's a consultation and evaluation. You talk about your needs, goals, concerns.
And they assess your situation.
Exactly. To figure out the best approach for you.
That assessment piece is vital for tailoring the treatment. Can't be one size fits all.
No. And following that, they develop a personalized treatment plan.
Which might include?
Could be chiropractic adjustments, massage, maybe other exercises or therapies. It sounds like they integrate things.
That fits the holistic description they use, looking at the whole picture.
Then, step 5 is basically starting the treatment. They mention ongoing guidance and support.
Which is important. You need that support as you go through it.
Definitely. And they also stress follow-up appointments.
To track progress.
Yeah, track progress,
Yeah.
see how things are going, and adjust the plan if needed.
Makes sense. Things change. Treatment needs to adapt.
And the last point they make is about communication. Keep talking to your provider.
Open lines communication.
Tell them about changes, concerns, anything really.
Absolutely essential. Therapy is collaborative. Your feedback helps them help you.
So, wrapping this part up, the main takeaway seems to be Advantage Healthcare in Spartanburg sees relaxation therapy, especially with massage, as really core to their holistic care.
Right. Addressing body and mind.
They aim to help with psychological and physical well-being, but they're also, importantly, upfront about the varying levels of scientific proof for all its uses.
And they have that clear pathway for you if you're interested in learning more or starting treatment.
From first contact through to follow-ups.
Precisely. So hopefully this look at their site gives you a clearer picture of what relaxation therapy can mean, at least in this specific clinic's context.
Yeah, if you're in the Spartanburg area or just generally looking at ways to manage stress, it's a concrete example of what's out there.
A tangible service offering.
And, thinking about that distinction they made, separating their relaxation therapy from things like mindfulness or yoga.
Yeah, that specific exclusion.
It does make you think, doesn't it? How do these different approaches target the mind and body? What are the unique benefits of focusing specifically on, say, behavioral techniques and physical touch, like massage, compared to more meditative practices?
That's a really interesting question to ponder. There isn't necessarily one right answer for everyone.
No, definitely not. But it's something worth considering maybe as you explore what might fit best for your own needs and your own path to well-being.